Yeah, so the fact that we're talking about immunotherapy and MPNs in one sentence is what I would call progress. So I'm excited about talking about this topic. I'll be covering a few things today. One of them will be covering the mutant CALR-directed antibody field, which is growing with the investigational products from Incyte as well as J&J. As you know, the Incyte product is a neutralizing antibody that basically binds on to the mutant CALR on the surface or the cell surface and blocks signaling. And the J&J product is a bispecific, so it engages mutant CALR on one end and engages the CD3 on one end to cause cytotoxicity. The second piece that I will be covering will include regulatory T cells. So this is work coming from MD Anderson. As you know, the T regulatory cells are depleted in a myelofibrosis marrow. T regulatory cells are important for the maintenance of inflammatory equilibrium. So using T regulatory cells derived from cord bloods, which is in surplus amount available for use at this time, are being explored in bone marrow failure syndrome, and there were 4 patients with myelofibrosis in that study who showed some responses. So now there is a separate study for CXCR4 enriched T regulatory cells, specifically for myelofibrosis, which Dr. Masarova is leading at MD Anderson. And then we'll talk more about the traditional form of immunotherapy in the context of transplant. So that's going to be point number 3. But we'll digress a little bit from transplant, but we'll talk about relapse prevention post-transplant, because relapse remains a big challenge post-transplant. We've shown that in our institutional data as well as national data in myelofibrosis, close to 40% relapse rates post-transplant, and in MDS MPN overlaps, we've shown more than 20% relapse rates, and those can reach up to more than 40% in the context of more than 2 high-risk mutations and or with mutations such as EZH2, RUNX1, and SETBP1. So we'll talk about some potential applications of cellular therapy in the context of preventing relapse post-transplant. So I'm super excited to talk about all of that.